Doctors of Reddit, what do patients do that annoy you? Non-compliance. Oh, you're not feeling any better after the antibiotics? I didn't take them. Med student, but usually something along the lines of, are you smoker? Double quote. Nope. Have you ever smoked? Yes. How long were you smoking for? -2 packs a day for 50 years. When did you give up? Double quote. 3 days ago. My partner is a doctor. She had 2 answers. First, the doorknob comment, come for a 15-minute appointment, spend 14 minutes talking about a mild cough. Then as she goes to leave the room, patient suddenly remembers, oh, yeah, and my dong is green and smells strange. Second, having to write medical certificates letter for employers that require them if someone takes a day off because they're sick. Waste of everyone's time. Patient stated he has a cold. Examined and determined that patient does indeed have a cold. Thanks for wasting my time. When patients tell me I've got a really high pain threshold during the history and then act like they are being axe murdered when I take blood or put in an IV line. I've got a really low needle threshold. When they come in with non-evidence based, unproven and sometimes dangerous recommendations from their naturopath's egg, broccoli juice cures cancer. Or they come in saying my chiro said I had a stomach parasite but luckily he fixed that. And that prostate cancer you said I had last year seems to be gone now with my homeopathic spider venom. I'm just here for a checkup because I can't ejaculate anymore and there is blood in my urine. When they bring their family member who has some medical training and that family member orders me around. It is not their fault, but where I came from we have to see 40, 60 patients in an afternoon. Time is of the essence and we have nearly 15 minutes to interview, figure out what they have and tell them what can be done. Because of the time frame, during the interview we need objective answers, something patients avoid like heck. We ask when the pain started and they say, well, I was at Mary's wedding when it started. Thinking, who's Mary? When was it? 28th day. Thinking, of which month? I have several other patients and don't want to be rude with this one, but I need answers. Physical therapist here. When this conversation happens. Patient, you made my back pain worse. Me, oh no. Which home exercise aggravates your pain? Patient, I didn't do them. Me, okay, then what did make your back pain worse? Patient, I have no idea. Me, what did you do yesterday? Patient, well, I felt better after you examined me. So I played golf for 6 hours yesterday, went to roller derby practice, helped 3 friends move, ran a half marathon with no training, and now I feel worse. Me, Fasipum. I've done nothing and I'm all out of ideas. I've offered to refer people to physio, and they've refused because they just give you exercises. Rage. When they come up with these miraculous ways to lose weight fast or ways to keep looking young. Come to me and ask me what they could potentially have, and then interrupt me because their Google PhD knows better. Animal doctor here. I hate when clients bring in their pets for a sick exam and decline all diagnostics and treatments. It's one thing if they're financially in a rough spot, I try to help them out as much as I can. But it's another when they say things like I just don't believe in medicine or I think I can fix this with coconut oil, turmeric, essential oils, crystals, and I don't trust any of your advice. I feel like I've done nothing to help their little friend and I worry about their pet all day. Bonus anger when they want to pay for a toenail trim for $20 and the medicine they've declined is cheaper than that. I've even gotten those when I try to give them a free trim so that I could send home meds. Not a doctor, but pharmacist chiming in. Patient, I have a 2-year-old with a runny nose, and I found this homeopathic remedy that doesn't actually have any medicine in it. Is this a good choice? Me, well, there's no evidence to suggest that this product is effective, but this Claritin Zytec is not only cheaper, it has real medicine in it that has been clinically proven to help manage allergy type symptoms including runny nose, and is labeled for use in a child this young. Patient, no thanks, I'll just give this other crap, after wasting 10 minutes of your valuable time, against your professional advice. While I don't see it often, there is one thing that annoys me about patients, though I wouldn't express it to them. Anyone who defends cigarette use as something more natural, relatively innocuous. I had the aunt of a pregnant teenage patient rhetorically ask me if quitting smoking would cause a shock for the baby and therefore be harmful for the pregnancy. It was clear from the tone that she thought the girl should continue to smoke. Another wanted only natural medications, vitamins during the pregnancy, no vaccines, fully natural childbirth with no cord cutting, all of which I am fine with for the record, but continued to smoke 1/2 ppd during the pregnancy. To all smoking pregnant preconceptual patients I say, for the grand majority of pregnancies, up to the point the child is born, you quitting smoking is more important than anything I can do as a doctor, and I will gladly help you in any way I can towards that goal. Not a real doctor but a dentist here. There are a few things that irk me, but I do realize that people really do not want to come to the dentist, so I try my best to ignore most of it. So the only thing I'll say, without trying to toot my dentist horn here, is that believe it or not, a lot of the things we do in dentistry on a day-to-day basis are actually pretty difficult technically. The fact that we do it so often that it becomes routine does not change that. I realize that patients have no idea what I am doing in their mouth for the most part, but believe me when I say that mistakes within fractions of a millimeter can mean the difference between an amazing result and catastrophic failure. As such, when patients have either a bad attitude or are not interested in trying to help me, it adds a huge degree of difficulty to something that is already hard enough. People who don't open wide on purpose even after being asked, or keep trying to sit up and want to rinse constantly, or ones that try to grab my hand when I am giving an injection or drilling. I'm not asking you to do or not do certain things solely for my own good. It's actually for your own good so that I can achieve a great result for you and your dental work. And also so that I don't accidentally bury my drill into the side of your tongue or the floor of your mouth while you are squirming around. I'd say the general belief many patients have nowadays that pain is never okay, that being sick and feeling like crap while your body heals is unacceptable. You broke your ankle. I can do lots of things to help you heal and be in less pain, but it's going to hurt. Being pain-free is impossible. You have the flu? You're going to feel like complete ass for 5-7 days. Feverish, achy, weak, coughing. Frankly, unless you're seriously ill, you shouldn't be contaminating your community and my waiting room. Go to bed. Take Tylenol or ibuprofen, fluids, and wait. Not a doctor, but my mother is, so I heard all the stores while growing up. Here are a few things that annoy her. 1. Arriving late to your appointment. If you arrive late and she's already behind and seeing the patient after you, she may ask you to reschedule if it's not an emergency. If you know you're going to be late, call in and let them know. It might save you a trip if the doctor is already behind, or they could tell you to come in anyway. 2. If it's your first appointment, try to arrive at least 15 minutes early. There is going to be paperwork. 3. It's obvious when people come in just looking to score some opiates or pain medication. It's sad and she wants to help, but most all of those people are just looking for drugs, not help. 4. If for some reason you do not want a female doctor, you should tell the scheduling people when you make your appointment. It's happened a few times where a man would come in and not allow her to touch him due to religious restrictions. You just waste everyone's time with that. 5. Don't just stop taking your meds because you start to feel better. Oftentimes the meds are what makes you feel better, so if you stop them you will be back to square one. Some meds need to taper down, so it can be dangerous to go cold turkey. 6. If you do not speak English or are calling in for someone who does not know English, please let the staff know when they schedule the appointment. The clinic is required to pay for an interpreter for you. If they show up and cannot communicate, there is not much that can be done. If this is the case, please show up because they have to pay the interpreter even if you don't show up. 7. Pay your bills. The billing department will work with you. If you have a certain number of unpaid bills, you will not be seen. Some guy once hired one of those services that claimed to reduce your medical bills by negotiating for you. That sort of thing only really works with hospitals where you don't have reoccurring visits. The hospitals might settle for getting a lower amount rather than getting even less by selling it to a collection agency, but a clinic that you have to go back to every 6 months will just fire you as a patient. 8. Don't be a dong. The doctors and nurses are doing their best to help you and deserve respect. They do not have to see you, so don't go treating them like some minimum wage cashier. You should also treat cashiers with respect and try to walk all over them. My mother has fired patients who were repeatedly rude to the front end and phone personnel. There is a section in your account where the staff can put notes for everyone to see when they pull up your billing info. If you're dong to them, it will show up there and you will find everyone much less accommodating. Belittling their GPs, family doctors. I'm not a GP, but they don't just deal with colds and gastro. If the GP misses your DVT, you could die. If the GP misses your bowel cancer, you could die. If the GP doesn't treat you for a community-acquired pneumonia, you could die. If the GP doesn't realize that your headache is actually meningitis, you could die or be left with brain damage. And what is there to belittle? GPs in Australia can make at least $35 for 2 minutes of work. That's all it takes to sort out a sick note or a flu shot. Not a doctor, but when I'm doing history intake, when the patient says it should be in the chart for basic screening questions like do you have a family history of cancer? Bonus points if they're a brand new patient to the health system. Some of my absolute favorite things to hear as a GP. No, you see, I know my body, before diagnosing themselves with the most ridiculously far-fetched affliction they managed to Google. I have a high pain threshold, but before fainting from a hypodermic needle prick, I never, ever run a fever. Or the opposite. No, really. 36.5 degrees Celsius is a very high fever for me. You don't understand. I need this cold to go away as quick as possible, and that's why I really do need antibiotics. Oh, I'm sorry. That's alright then. My bad. Telephone call at 2:30 in the morning. I can't sleep well. Neither can I now. And yes, this actually happens. My personal favorite are patients with lower back pain, demanding investigations for their kidney pain. Must be awesome to be able to diagnose yourself. What do you even need me for? And just for shoots and giggles, here's my real absolute favorite thing a patient has ever told me. My date of birth? How should I know? I never went to school. The biggest thing for me is not being able to provide a useful medical history. Even if you don't know anything about medicine, you should know whether or not you have diabetes, high blood pressure, lupus. Same for medications. Just write down a list and bring it with you. It's amazing how many people can't tell you how long they've had X symptoms, if they've ever had them before, etc. And no, I can't skip the questions and just look in the computer because the electronic records are often incomplete or out of date. I know we ask a ton of questions, but I promise they're important and it's really hard to help you if you can't answer any of them. I stopped taking my medication 3 months ago because my bingo buddy said it doesn't work. No, I didn't tell you because I thought you'd be upset. I want what's best for you. If you're not okay with the treatment, we can talk about it. Also, when said friend comes in and says they only used their daily meds once a week because it didn't work, gee, I wonder why it wasn't life-changing. Not a doctor, but I work as a technician for a dentist. Whenever a patient says I'm planning to go to insert a place ridiculously far and permanent trip out of the country in 2 days, please get this done by then. When that happens, you're basically asking for a crap job. There's a good chance whatever work you're getting won't fit properly, or may crack break in a few months. Besides the obvious rush mentality that gives the result a risky conclusion, it's also because you give very little option to the dentist to do try-in appointments. The try-in phase is very important and a good investment to ensure that your restoration will turn out good. To compare, what you're basically doing when you ask for something in 2 days is you're completely skipping the test drive and just buying the car off of what you know from specs and then expecting to be satisfied with it. Be kind and give your dentists and technicians a good minimum 4-5 working days for low unit jobs. That is, single crown, denture flipper, and 8-12 working days for high unit jobs, full mouth restorations, multi-unit crowns and bridges, implant work, for each part of the phase. I'm a dentist, and we know most patients are pretty high anxiety and everybody deals with that in their own ways. Sometimes it's talking a lot, sometimes it's wincing even though nothing hurts, sometimes it's even being mean to me or my staff. We get it, and that is why we spend time before any procedures explaining things and talking about anything you want. but what really annoys me is once we get going, I just need you to sit still and keep your mouth wide open. I am performing microsurgery on your tooth with a very sharp drill that spins at 300,000 revolutions per minute, and I need to make cuts to tolerances of 1/10 of a millimeter in dark confined spaces in the back of your mouth. I'm sorry you don't like the feeling of your own saliva pooling in your mouth, but I just need you to suck it up for 30 seconds so I can do a good job and we won't have to redo this in 6 months. My dad is a dentist. When he was removing my wisdom teeth, my mom was the assistant. I gave him the opposite problem. I was so comfortable with them and drunk on nitrous that I kept asking all kinds of questions. About halfway into the procedure he had to stop and tell me that he appreciated my interest in learning, but could I please just shut up so he could perform surgery. Wife is a radiographer. She takes the x-ray pictures. It's all the people who just don't freaking listen. Lie on your side does not mean on your front. Hold still means exactly that. By having to redo x-rays, people are getting extra doses of radiation. I cannot believe how stupid these people are from the stories she tells. Patients who don't use their screening opportunities. I'm in the UK so it's all free, but so many people don't get their cervical smears, or bowel cancer screening, mammograms, routine STI and HIV checks, not just when you think you might have caught one. It's such a small part of your time and has the potential to save your life. Not doctor but former EMT. The final answer is lie. Lying to a healthcare worker is the most irritating and infuriating this people can do. Honestly, no one gives a crap. But when you say your issue started 30 seconds ago, but it's been 3 weeks, it could be a very different potential diagnosis. Probably not the best example, but so many people lie to healthcare workers you quickly become a detective to cope with it. Abuses of emergency medicine. My blood sugar is high. How high? 170. How do you feel? Fine. Have you been taking your metformin? No, because I feel fine. The ones that bug me the most are the people that have a basic URI, the freaking common cold, come to the ED, and say something along the lines of "it's been going on a few days" when I knew I should come get checked out, and then look at me expecting a freaking pat on the head. Number, you didn't do good, you're a moron. Another thing I hate, because I'm officially venting now. How bad is your pain? 0-10. 0 is no pain, 10 is being on fire while covered in salt and lemons. 10 as they sit there freaking with their phone and eating Cheetos. Normal vital signs. No distress. Another one I hate. Big tough guy comes in, hurt his back working out or something. Pulled freaking muscle. 10/10 of course. X-rays negative. No neurologic deficits. Nothing wrong. Well, can you give me something for pain? Sure, take some Tylenol. That doesn't work for me. 10 minutes later. How can you be discharging me when I'm in this much pain? It's easy crap staying. I just printed your papers. I just wish these people could see how much time they are taking away from truly sick people. Also, stop being a P. You're going to hurt sometimes. We're only like 2 generations removed from most of the population doing hard labor where they lived with aches and pains all day every day. Now, a sprained ankle merits some Norco and a reassuring talking to. Ugh. The worst is the patient that is allergic to everything except the medicine that they want, which is dilaudid most of the time. You've been visited by the good sleep doggo. Like within the next 4 seconds and you will be blessed with cozy and restful sleeps. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day, you magnificent people.